Session number 1, Imprisoned by Panic. Welcome to the new therapy course. This time, we'll be dealing with one of the most widespread requests for therapy, the struggle against panic. Unexpected outbreaks of fear and anxiety make us less productive and stop us from enjoying life. Medication can help make these outbreaks happen less often, but it does not get rid of the reasons why the symptoms arise. This is why specialists recommend treating panic attacks through methods of cognitive behavioral therapy. Panic disorder needs to be worked through with a qualified psychotherapist. At the same time, we should not forget about self-help, which can ease your worries and make your work with a specialist even more effective. We have developed a supportive course for the struggle against panic. It is based on recommendations of practicing cognitive behavioral therapists. The course consists of audio sessions and exercises. It will help you learn more about panic attacks, master simple techniques for overcoming panic, and lower your sensitivity to fears in general. Are you ready to take the first step towards solving your problems? Then let's get started by looking into what panic is. Many people experience inexplicable fear and serious anxiety at least once in their lives. These feelings are accompanied by an increased heart rate and rapid breathing. This is how our bodies respond to danger or threats. The degree of response to stressful situations depends on the particular person. Some people experience light anxiety, while others pass through a whole range of vegetative symptoms like weakness, deterioration of concentration, and confused thinking. If these conditions repeat themselves regularly, they become a serious problem, and specialists call this problem panic attacks. Panic attacks are accompanied by insurmountable fear of death and loss of self-possession. Such bouts occur unexpectedly, so people who are prone to them are in a constant state of oppressive anticipation. They pay close attention to the first signs of an increased heart rate, shortness of breath, or nausea in order to prepare for an attack. People who have panic attacks try to avoid situations that might bring them on, and as a result, some people even become reclusive. It is not only stressful situations and psychological conflicts that cause panic. Focusing excessively on physical symptoms can be enough of a reason for an attack. These may cause us to feel really anxious and to have distressing thoughts like, "Oh, I don't feel well. It's definitely a panic attack starting." Thoughts like this worsen our psychological state. As a result, we prepare ourselves to either battle against the impending danger, flee from it, or simply freeze up. This is the normal physiological response of our bodies to stress, known as fight, flight, or freeze. So let's see what happens to your body during a panic attack. What happens on the physiological level? Blood flows to large muscle groups, so it seems like your legs have turned to jelly, even though they're stronger than ever. Your breathing becomes more rapid, and at the same time, you may feel a shortness of breath, as well as pain or tightness in your chest. Then the chain reaction goes on. When less blood reaches your brain, you may experience dizziness, confusion, and a feeling of unreality. Blood flow reduces to the surface of your skin, fingers, and toes. This is a physiological function necessary to prevent serious blood loss if your body is really wounded. Your extremities get cold, while your face becomes flushed. This elevated temperature can be explained by the active intake of oxygen and short-term changes in your circulatory system. You start sweating more, and your skin becomes damp. The digestive process slows, and you may experience spasms and/or nausea. It is very important to understand that these responses are short-lived and not dangerous. Nevertheless, they're very unpleasant and lead us to catastrophic thoughts such as, "Oh, I'm losing consciousness," or "I'm suffocating." And this kind of thinking leads to a rush of adrenaline to the blood, and the fight, flight, freeze symptoms intensify as you prepare yourself for the worst, for death or madness. And the cycle repeats itself, thoughts build up, and the symptoms are exacerbated. As a result, you end up on the verge of panic. But the cycle can be broken. You need to learn to see elevated temperature, dizziness, and the feeling of unreality as natural symptomatic responses to stress. And remember, they are temporary and not dangerous. If you manage to break off oppressive thoughts in time, the panic will stop within 3 to 4 minutes. This is how long the adrenaline metabolism process takes place. The main thing is not to scare yourself. Otherwise, you will keep being tortured every time this hormone is released. We have prepared 2 exercises for this session. They will help you understand how your panic attacks start and how to reduce their frequency.